Hey guys, Peter Dingle here, PhD, and I'm sure you've seen some of my videos about gut health and the importance it is for your immune system, but I want to explain what I call today the gut-lung virus infection link. Yeah, there is a direct link between your gut microbiome, all the microorganisms in your large intestine, and your lung or your respiratory microbiome. Now we've got microbiome, a skin microbiome, a a mouth microbiome, and the lung microbiome is very important for protecting you against all forms of infection. Now, decades ago, they discovered that when they were looking into the beginning studies of the gut microbiome, they were finding that people who had chronic respiratory illnesses, such as asthma, for example, bronchitis, bronchiectasis, and so on, all had an altered gut microbiome that reflected an illness, changes down there, and the seriousness of the condition up here. Now, more recently, they've also found that if you've got an altered gut microbiome, it's linked with increased respiratory infections. So they've done the test on mice, and they've shown them, they said, okay, here it is, you've got this altered gut microbiome, and they're exposed to viruses, and they get it. So in this, what I've got here is our gut health, which is the single most important thing you can do after physical isolation. Work on your gut health to improve your respiratory microbiome. And what it does is it decreases your risk of respiratory infections, the severity of the infections, and in the animal studies, mortality. In this day and age, that's pretty important. So we want to improve it. Now, the studies here are very clear. They've been done on mice and in humans, where they've gone to groups of people, large groups of people, and they've given them treatment and so on, and they've worked on improving their gut health. Now, I want to put a little proviso in here. When I talk about gut health, it's much more than fiber and probiotics. It's about a whole system, and that's what we talk about in our book, Gut Secrets. People ask me every day, what do I need to build my gut? Well, it comes back to you guys. Without question, you need to get that. There is no other book like it on the marketplace, and I'm sure many of you already have it, and you'll testify to it. It's got all the secrets to actually fixing your gut. But if we come back in here, it's pretty simple. On the studies on probiotics, so probiotics here, when they've used a number of different species, but the two that keep coming back time and time again are Bifidobacter and Lactobacillus. Now these are the ones you would have heard of. They're not uncommon, but it's about the dosage that counts. The more, literally, the merrier. But with what happens with probiotics is that they work on the way through. They don't get lodged there and work for 4 months later and 4 years later. They work on their way through like a bit of a summer day holiday from anywhere from 4 hours to 4 weeks. The studies show fiber and prebiotics are effective, and symbiotics, which are a combination of those, all go to decrease respiratory health, severity, and mortality. Wow, how simple is that? You mean to say, a 50 cent or $1 a day solution can do that? And what's interesting is the studies have been shown that even when they've got the infection, so mice have been given this deadly infection where the ones untreated 100% die, and they're given this probiotic and fiber and prebiotic and symbiotic or things like that at the time of the infection, then the mortality rate declines dramatically at the time of infection. So this is one of the great strategies I'm telling people, that have the probiotics on hand, build up your gut now. We should all be working on our gut based on what I tell you in Gut Secrets, and then using those as the first line of treatment if you get any form of infection, any form. So it shows, all the studies show decrease and significant decreases. Now, at the other end, we've got dysbiosis, which is a dysfunctional microbiome in the large intestine. Then we have increased risk of respiratory infection, severity, and mortality. So in the studies where they've gone and found people and animals with dysbiosis, and they do the number crunching, they get more of the viruses, more severe, and increased risk of it. Now, we also know that because if they treat any of these animals or humans with antibiotics prior to getting a viral infection, so the antibiotics will go down and knock out the gut microbiome and create a state of dysbiosis, as do all the antibacterial chemicals we're using at the moment to wash our hands with. And these antibiotics will knock out the good gut bacteria, create a state of dysbiosis, and it increases the risk of respiratory infection, severity, and mortality. Wow, hold on. That's scary, isn't it? So we really need to think about it. We know we've got to constantly work on rebuilding it. And so it comes back to here, the antibiotics work. We also know that the elderly are at dramatically increased risk of respiratory infection. Now, I'm going to cover this in another a video blog because this is so important. But it's not just the elderly at increased risk because they're aging. There's another factor coming in here, and it really does look like what I call polypharmacy. And the risk, if you've got hypertension, and you're over 80, the risk of you getting an infection is about 20,000 times higher than that of a teenager. So do you get me? Something's wrong here. Something's going on that we're not being told yet. Well, we are in the journals. I'll share that with you later. It's to do with some of the drugs that people are taking for blood pressure. Really time to look into that one. So we know these people with pre-existing conditions and so on. All these heart attacks, strokes, hypertension, which by the way, all shows up in the literature to upset the gut microbiome. So we know if you've got high blood pressure, your microbiome is in a state of dysbiosis. Same with diabetes. So we know even from there is this link. So all of this is showing fix your gut, and if it's bad down here, start really working on your gut. And that's where the book Gut Secrets goes well beyond just the probiotics and so on. But at this stage, I want to make it very clear, as I just put this out of the way, is that we've got our gut microbiome. So our gut microbiome over here, when you've got your gut microbiome and it's working well, you get this positive cycle between your lungs and your respiratory microbiome and your microbiome in your large intestine. When you improve your gut microbiome, it increases and improves your lung microbiome and further increases your gut microbiome. So it's a positive cycle here, a virtuous cycle. So if we do something to work on our gut microbiome, so we have drink some green tea and we have some curcumin and we have some aloe vera and we have some all these other things as well as those, then all of a sudden we're going up in this state, which is decreased risk of respiratory infections. However, on the other side, if we're in a state of gut dysbiosis, so our gut isn't functioning properly, it then leads to lung dysbiosis, which then leads to more gut dysbiosis in a vicious cycle. And the problem with all this is that it doesn't just open yourself up to more viral infections, but it also opens you up to a serious co-infections with other viruses, and in this case, to do with the COVID, other bacterial infections, which can end up being severe and terminal. So the message is here, if we can work on this, so when your lung microbiome is healthy, then your gut microbiome is healthy. If your gut microbiome is sick, then your lung respiratory microbiome is sick. So if you can start working on this one down here by building your gut health, which is your immune system effectively, and it talks to the lung microbiome, sending chemicals up and direct messages via the nervous system and your vagus nerve and so on, it starts to improve your gut. And as a result, it's a win-win-win situation. But it's time to start now and use these as part of your building blocks, but it's only a part of the issues. I hope you've got something good. If you have, please share this information with people out there because we can make a real difference to how people are affected by this virus.